Vitamin A is a fat-soluble vitamin. It helps maintain healthy teeth, skeletal, skin, and play an important role in vision and eye health. Stellate cells contain about 90% of hepatic retinol in normal conditions and are responsible for uptake, storage, and release of the retinol. In healthy persons who consume an adequate diet, these reserves are sufficient to support the body's need for at least 6 months. Deficiency of vitamin A impairs hematopoiesis and immunity and cause typical ocular effects such as xerophthalmia and night blindness. Vitamin A deficiency also leads to epithelial metaplasia and keratinization. The most devastating changes occur in the eyes and result in dry eyes, which is known as xerophthalmia. Lastly, excess of vitamin A can lead to hypervitaminosis A and harm the hematopoietic and osteoarticular system. Vitamin B12 is a type of water-soluble vitamin that are mainly used as a coenzyme and cofactor in DNA synthesis, synthesis of myelin, and formation of red blood cells. Under a normal condition, vitamin B12 will then be cleaved in the small intestine, while the intrinsic factor can now bind to the receptors in ileum and then being absorbed into the bloodstream. Insufficiency of vitamin B12 can lead to pernicious anemia. Symptoms range like fatigue, lethargy, difficulty in walk, headache, weight loss, etc. A severe deficiency in vitamin B12 can also affect the individual to have neurological disorder like anxiety and depression. Since vitamin B12 is water-soluble, it is generally considered safe even an individual consume a high dose aka mega doses of vitamin B12. But the supplement with extremely high level of vitamin B12 can still cause negative adverse effects like diabetes and kidney disease.
Vitamin C, also known as ascorbic acid, is a water-soluble vitamin. It aids in detoxification, essential for synthesis of collagen, growth development, and plays an important role in allowing for hydroxylation of procollagen involved in all phases of wound healing in the body. It is also a major agent in depigmentation of skin and plays a role as antioxidant. In normal condition, vitamin C is absorbed through the blood capillary from the small intestine. Ascorbate is transported by sodium vitamin C transport type 1 in epithelial cell, and the remaining is transported by sodium vitamin C transport type 2 in specialized cell. Deficiency of vitamin C leads to scurvy due to the alteration in collagen synthesis. It also leads to epigenetic DNA hypermethylation and inhibit the transcription of various types of collagen, inadequate synthesis of osteoid, and bone become brittle. Excess vitamin C leads to extreme increases of iron absorption and overloads of iron. Too much vitamin C can also cause stomach pain, diarrhea, nausea, vomiting, heartburn, abdominal cramps, headache, insomnia, and flatulence.
Vitamin D is fat-soluble vitamin to maintain calcium blood and for bone health. We can get it from fish, cheese, and mushroom. In normal, 7-dehydrocholesterol convert to inactive vitamin. For activation, D25-hydroxylase catalyzed to calcidiol in liver. It transformed to calcitriol by alpha-1-hydroxylase in kidney. It facilitates intestine calcium absorption, kidney reabsorption, and rebuilding bone tissue. Like vitamin D affect in low ionized calcium, so more PTH produced and high calcium reabsorption. Calcium serum is below normal and phosphorus loss. Insufficient both iron affect poor bone mineralization and lead to bone disease. Vitamin D toxicity is when someone overuse supplements. It can lead to hypercalcemia when PTH will overproduce. This increases calcium reabsorption and bone resorption, so high calcium serum in blood happens.
Vitamin K is a type of fat-soluble vitamin that can be classified into vitamin K1, vitamin K2, and vitamin K3. It mainly functions in blood clotting and also bone metabolism. In normal condition, metabolism of vitamin K occurs mainly in the liver, but absorbed through the jejunum and ileum in the small intestine. Vitamin K is an important dietary component because it is necessary as a cofactor in the activation of vitamin K-dependent proteins. Insufficient vitamin K may result from extremely inadequate intake, and this will cause a decreasing level of prothrombin, leading to defective coagulation, hemorrhagic disease of the newborn, and a range of disorders, including muscular dystrophy. Vitamin K toxicity is rare, but still can cause anemia due to rupture of red blood cell and too much bilirubin in the baby's blood, leading to jaundice. Vitamin K is necessary for normal blood clotting, but it is not effective for treating clotting problem caused by severe liver disease, which can cause clotting problem become worse.